We have a lot to get to this evening. Oregon is now in a state of emergency as the number of COVID-19 cases and deaths continues to rise in the Pacific Northwest. 7 more people have tested positive in Oregon, and we're just learning one of them is a middle school student at South Meadows Middle School in Hillsborough. That district says it will not be closing, and the school is getting cleaned tonight. Without further ado, let's get to our Fox 12's Sarah HURWITZ, who is at today's press conference with the governor. She joins us now live at OHSU. Sarah?
Yeah, good evening, Bonnie. Governor Kate Brown says she's declaring a state of emergency to give the state the resources it needs to combat COVID-19. Now, we're here at OHSU. This is where the hospital confirms that it alerted employees over the weekend that a patient here had a presumptive positive test for COVID-19. Now, with those 7 presumptive cases here in Oregon, those new cases, this now brings the total cases here in Oregon to 14.
9 days after Oregon announced its first presumptive case of coronavirus, Governor Kate Brown taking quick action Sunday to stop the spread of the disease.
I am declaring a state of emergency to ensure that we are able to swiftly deploy the personnel and resources necessary to address coronavirus in Oregon.
That state of emergency declaration, Governor Brown says, will last for 60 days and will give the Oregon Health Authority and the Office of Emergency Management the resources it needs to contain COVID-19.
Local and state health officials are working around the clock to address this crisis.
It activates Oregon's reserves of emergency volunteer healthcare professionals, which Governor Brown says will particularly be important for rural Oregon, where access to medical care can be limited. As that declaration came out, Oregon Health Authority Director Patrick Allen announced the Oregon legislature will consider an emergency $5 million request on Monday for funds to fight COVID-19 in Oregon.
COVID-19 is a communicable disease. We know it will spread. We know we will see more cases.
Allen says the focus remains on the populations at greatest risk: older adults, people with underlying conditions, and the homeless or those who face other barriers to medical care. Now, here's what we know. The Oregon Health Authority says of those new 7 cases, there's 1 in Douglas County, 1 in Marion County, and there are 5 new cases in Washington County. According to OHA, the cases include a mix of community spread and spread related to contact with a previous case. OHA says 3 of those people were hospitalized at the time of diagnosis, and the remaining cases experienced mild illness with symptoms and are now recovering at home. OHA says investigations are underway to identify and isolate anyone who might have been in close contact with these cases, and it says it's expanding testing, preparing to activate trained and licensed volunteers who can help in rural communities, and it's also expanding efforts for people to have access to telemedicine so they don't have to go to the doctor and potentially expose others. Now, as healthcare officials continue to track development of the coronavirus, Allen says we cannot shun or stigmatize people who become ill.
We cannot combat COVID-19 if we turn on each other. COVID-19 does not discriminate. That only puts sick people and the broader community at risk because it discourages people from seeking the help they need, from getting tested, from getting care, and staying at home.
Now, OHA says most people who contract COVID-19 get mild symptoms. It recommends minimizing contact with people who might be ill, avoiding large public gatherings, having prescriptions ready to last you a while. Also, it recommends washing your hands, not touching your face and eyes, and cleaning surfaces. Now, that state of emergency will remain in effect for 60 days, though Governor Brown says it can be extended until that public health threat is contained.